Hello everyone. Today we will discuss a transfer letter. First we will go through the case notes. Then I will select the content, and in the end we will write a letter. So let's start. Like other letters, we will start from writing task. Whenever we start reading our case note, start reading from writing task. It's very important. Okay, first thing is to read writing task. Let's go through it. Using the information on case note, write a letter of transfer to Queensland Royal Hospital where Mrs. Smith and her newborn baby can be monitored and cared by an obstetrician and pediatrician respectively. Address the letter to admission officer. So we know that we should write a transfer letter where to Queensland Royal Hospital and for monitoring and care of Mrs. Smith and her newborn baby. This is our purpose. Monitoring and care of newborn baby and Mrs. Smith by a pediatrician and obstetrician respectively. We will write this letter to admission officer. After writing task, we will go through this plan. In plan, immediate transfer of both mother and baby to hospital with NICU care. Neonatal resuscitation and premature neonatal care, complete examination by pediatrician, maternal risk factor management by obstetrician, counseling for next pregnancies. By going through this plan, now we have a clear idea about our purpose, that we are transferring the mother and the baby for further care and monitoring, specifically NICU care. So next thing is to go through plan. We have gone through the plan. Third thing is to go through all the notes. We'll start from the top here, notes. From notes, I will highlight the content which is important, the content which I will include in the letter. Assume today's date is 5 December 2021. Before I select the content, I want to give you a little bit summary of this case note. This is a case note about mother who was admitted when she was in active labor, and she has delivered a baby in the hospital. The baby was cyanosed and baby was resuscitated in the hospital. However, baby is still cyanosed and hypothermic. Therefore, we are transferring the baby to another hospital with an ICU care. So with that knowledge, now we can select the content. So assume today's date is 5 December. You are a junior doctor working at Cow Bay Primary Health Clinic, 69 Tea Tree Road, Diwan QLD 4873 Australia, and Mrs. Julia has presented in active labor and baby was delivered successfully. Then patient details. In patient details, patient name is important, definitely. Age or date of birth, sexual date of birth, husband's name is not important here. Then patient's past history, No records available from Cyprus. Visiting in-laws in Australia. Used to get monthly visits from local midwife. Hospital visits. No vaccinations. Allergies unknown. Then family history. We don't need to include any of these from past history. We can simply write on that there no past treatment records are available. We can write that, or we can skip all of it. Then family history. In family history, mother diabetic, father hypertensive, had two strokes, sister, two elder sisters, eldest one is diabetic, four brothers, two hypertensive and diabetic, one had inguinal hernia. Here, history of diabetes and hypertension are important. As many of the family members have this condition, so we don't need to write their names or their relations. Simply we can write our family history is significant for hypertension and diabetes. Yes, we will include hypertension and diabetes. This is important, but we will write a summary of it only. But hernia is not important. Diabetes and hypertension, they're important. Then patient visit detail. Patient came today actually on 5 December, which is also 2 days date. You can see here on the top, which is 5 December 2021 here. So today patient came actually. Patient is G1P0. First I will read it, then I will select whatever is important. G1P0, 30 weeks of gestation, vaginal bleeding, small mouth, bust, water 6 hours ago, severe abdominal pain and back pain, episodic. Then objective, bloody show occurred, ruptured amniotic membranes, strong uterine contraction 2 minutes apart, cervical effacement 90%, head engaged, station 1+1, cervical dilatation 6 cm, fetal heart sound audible, maternal blood pressure 140/90, heart rate 98, deliver the baby since patient in active labor, have hydralazine hydrochloride 5 to 10 mg every 15 to 20 minutes until BP under control. No epidural, patient refused. Close monitoring, maternal vitals, progress of labor, oxygen if needed. Then at 8:40 a.m. This one 100% cervical effacement. This is effacement actually. Cervical effacement. Fetal station +4, strong frequent uterine contractions, stable CTG, maternal blood pressure reduced to 130 or 90, heart rate 80 per minute. Then plan, stop hydralazine, support labor progression, deliver the baby. At 9:10 a.m. here, deliver the baby, mother stable, no vaginal lacerations. So we will select the content until here. As here you can see, progression of labor is actually uneventful. This is how a normal labor progresses, except the raised BP, which is 140 or 90, for which IV hydralazine hydrochloride was given. So we will mention that except raised BP and its management by IV hydralazine, we won't mention anything else. We will just simply write progression of labor remained uneventful except a raised BP for which this medication was given. So let me select the content. This G1P0 is important, like she's primary gravida, presented at 30th week, definitely important. We will write a summary of all of them. Then progression of labor remained uneventful, but I'm not going to write all of them. Other than that, we need to write maternal blood pressure 140/90 is important, and for that we have given IV hydralazine hydrochloride 5 to 10 mg every 15 to 20 minutes until BP under control. Then we will write this much only. Okay. Then baby's nursing notes. In baby nursing note, here she delivered the baby. Actually, we will mention that baby delivered, mother stable. Okay, baby delivered, mother stable, nothing. Okay, and in nursing management, a baby's APGAR was 5, weighing 4.1 kg, not crying, cyanosed, massaged and back slapped, crying started, kept on warmer, nasal suctioning done. Baby nursing management is very important here because we are actually transferring the baby for an ICU care. Then 5 minutes later at 9:16 a.m. APGAR improved to 7, but baby is still hypothermic and cyanosed. Therefore, we are transferring the baby to a facility with an ICU care. Again, the plan, that the one we have just gone through. Okay, immediate transfer of the baby, of the both mother and baby, to hospital with an ICU care for neonatal resuscitation and premature neonatal care, complete examination by a pediatrician, maternal risk factor management by obstetrician, counseling for next pregnancies. We will write all of them. They are important. Now we have selected the content, okay, and we can write a letter with the selected content. So first thing to write is the address. Your address is actually Queensland Royal Hospital and admission officer. To the admission officer, and hospital is Queensland Royal Hospital. So we will write the admission officer, Queensland Royal Hospital, in the address. The admission officer, Queensland Royal Hospital. After address, next thing to write is date. Today's date is 5 December 2021. 5 December 2021 is given on the top here. This one. Then greetings, dear admission officer. Which is given here in writing task. So I want to clear something here actually. When we don't have reader's name, here we don't have reader's name, we have his job title, admission officer. So we don't have, if we don't have the reader's name, we will write job title rather than dear sir madam. Okay, so dear sir madam is inappropriate. We should write the job title, dear admission officer, dear emergency registrar, dear medical registrar, whatever the job title is. Then RE9, In RE line, we will write patient's name and date of birth. If we have two patients, if we are referring, transferring two patients, then we should write name of both. Okay. So here we have two patients actually. This is Julia Smith and her baby. So we'll write name of both the patients actually. Like this, RE, Mrs. Julia Smith, date of birth 21/10/2000, and her newborn baby. We don't need to write date of birth of newborn baby, as newborn show that she's the baby is newborn. Then introduction. Before I write the letter, I want to give a summary of structure of transfer letter. Transfer letter is a type of letter from one hospital to another hospital normally. For care like for NICU care, ICU care, or rehabilitation purpose or something. Okay. So the other doctor which is in the hospital has no relationship with the patient, no existing relationship with the patient. So we need to write patient's past medical history here as well. So as well as hospital visit details, hospital admission details actually. First is introduction. Second is past medical history. Third is patient's presenting complaint. Fourth is hospital stay details. Then current status, and in the end conclusion. So introduction of a transfer letter is little bit structured differently from from referral, from discharge, from other letters. Okay. So here we can write, thank you for accepting Mr. Julia Smith and her newborn baby into your care for further management, including an ICU care. We will write the further details about our purpose in the conclusion. In the introduction, this is sufficient, like further management, including an ICU care. Thank you for accepting Mrs. Julia Smith and her newborn baby into your care for further management, including an ICU care. Then we will write patient's past medical history. Patients in this case, patient's past medical history is insignificant actually. We don't know anything about her past medical history, but she has a family history of diabetes and hypertension, which is important. It's given here, family history here. Diabetes, hypertension, they are important. We'll write them here. Mrs. Smith is a prima gravida, and her family history is significant for diabetes and hypertension. Then we will write the patient's presenting complaint, the complaint with which patient was admitted actually. So in this case, you can see here patient presented in active labor actually, and she was G1 P0 and at 30th week of gestation. So what we'll write today, Mrs. Smith presented in active labor at 30 week of her gestation. Presented active labor at 30 week of her gestation. Then what else? We talked earlier that the progression of labor is actually uneventful. We only highlighted here patients raised BP and treatment for it. We will include that. 4290 BP. Then IV hydralazine was given for that. We'll mention that. Okay. So we'll write progression of labor remained uneventful except for an elevated BP of 140 over 90, for which IV hydralazine hydrochloride 5 to 10 mg every 10 to 15 minutes, 15 to 20 minutes was given. Progression of labor remained uneventful except for an elevated BP of 140 over 90, for which IV hydralazine hydrochloride 5 to 10 mg every 15 to 20 minutes was given. After that, we will write the details when the baby is delivered. Actually, baby was delivered at 9:10 a.m. We can write the actual time when the baby was delivered. It may be important for the reader to take care of the baby. So we'll write at 9 a.m. Mrs. Smith delivered a baby boy weighing 4.1 kilogram. Weight is given. We'll write weight. We'll write patient's baby's FCAR score. We'll write okay. So baby delivered, mother stable, FCAR was 5, weight was 4.1 kilogram, baby was not crying, massage, then back slapped, then started crying, kept under warmer, laser sectioning was done, then FCAR score to 7, baby is still hypothermic and cyanosed. So we write here at 9:10 a.m. Mrs. Smith delivered a baby boy of 1.4 kilogram who was cyanosed and was not crying. At 9:10 a.m. Mrs. Smith delivered a baby boy weighing 4.1 kilogram who was cyanosed and was not crying. Then what? Then babies, we will write baby's FCAR score here. Then we will write that we massaged the baby, we kept it under warmer, we back slapped the baby, then baby started crying, then baby's FCAR score improved to 7. Then we will write, however, baby is still hypothermic and cyanosed. Let's go through this. The baby's FCAR score was 5 at birth. We checked FCAR at birth at 1 minute and then 5 minutes. at birth, which improved to 7 at 5 minutes. The baby started crying after massaging and back slapping. Additionally, he was kept in a warmer and nasal suctioning was done. However, the baby is still cyanosed and hypothermic. This is the reason why we are transferring the baby. Then our plan is immediate transfer of baby and mother to hospital with NICU care. We can mention that or we can skip that. If you can want to mention it, we can write like, therefore it was planned to transfer the mother and baby to hospital with an ICU care. Therefore, it has been planned to transfer the baby and mother to a hospital with an ICU care. Then is the conclusion. In the conclusion, we will actually explain what we want from the reader. Here we are transferring the baby and mother for further care like an ICU care. It's written in detail like an ICU care for what? For neonatal resuscitation and premature neonatal care and complete examination by a pediatrician. We will include all of it. And next is maternal risk factor management by an obstetrician. For mother, maternal risk factor management and counseling for next pregnancies, future pregnancies. So, in the conclusion, we will write, it would be appreciated if you could provide the baby with immediate neonatal resuscitation, premature neonatal care, and a complete examination by a pediatrician. Additionally, Mrs. Smith needs risk factor management and counseling for her future or next pregnancies by an obstetrician. It would be appreciated if you could provide the baby with immediate neonatal resuscitation, premature neonatal care, and a complete examination by a pediatrician. Additionally, Mrs. Smith needs risk factor management and counseling for future pregnancies by an obstetrician. Then we can write in the end to invite further queries and questions. After reader, we will write, if you have any queries, please do not hesitate to contact me. Should there be any queries, please do not hesitate to contact me. Then we will sign off the letter. So one thing which is different from other letters, instead of writing yours sincerely, we will write yours faithfully. In the letters where we don't have reader's name, like in this case, reader is an admission officer. Okay, this is a job title, not name actually. So when we don't have name of the reader, when we sign off the letter, we will write yours faithfully. Otherwise, it's yours sincerely. If you know the name, it's yours sincerely. Yours sincerely. Here, yours faithfully. Yours faithfully, doctor. So let's go through our letter. Proofreading is very important. The admission officer, Queensland Royal Hospital, 5 December 2021. Dear admission officer, regarding Mrs. Julia Smith and her newborn baby. Date of birth of Mrs. Julia Smith is 21/10/2000. Thank you for accepting Mrs. Julia Smith and her newborn baby into your care for further management, including an ICU care. Mrs. Smith is a prima gravida, and her family history is significant for diabetes and hypertension. Today, Mrs. Smith presented in active labor at 30th week of her gestation. Progression of labor remained uneventful, except for an elevated BP of 140 over 90 mmHg, for which IV hydrochloride 5 to 10 mg every 15 to 20 minutes was given. Then at 9:10 a.m., Mrs. Smith delivered a baby boy weighing 4.1 kilogram who was cyanoused and was not crying. The baby's APGAR score was 5 at birth, which improved to 7 at 5 minutes. The baby started crying after massaging and back slapping. Additionally, he was kept in a warmer and nasal suctioning was done. However, the baby is still cyanosed and apothermic. This is repeated actually. However, the baby is still cyanosed and hypothermic. Therefore, it has been planned to transfer the baby and mother to a hospital with an ICU care. It would be appreciated if you could provide the baby with immediate neonatal resuscitation, premature neonatal care, and a complete examination by a pediatrician. Additionally, Mrs. Smith needs risk factor management and counseling for future pregnancies by an obstetrician. Should there be any queries, please do not hesitate to contact me. Yours faithfully, Dr.